Hello everyone. As you know, in our body, ear is a very important sensory organ. We receive 15 to 20% of total information through our ears. Without hearing ability, it is very difficult to be a part of the society. In a classroom learning situation, hearing and vision are the two major senses that receive information and hence a child with hearing impairment will have difficulty in learning like other children. Teachers have to be sensitive to be the needs of these children so that they learn optimally. So, today we are going to understand about hearing impairment. Hearing impaired means those children who are not able to understand the given instructions. This problem contains children having less problem with listening and completely deaf. When a child takes birth, he develops his listening skill and after that reading and writing. This kind of child faces many problems in his life. It is a basic skill for developing another too. So, due to lack of this skill, he remains an incomplete human being. The child gets instructions from gestures. He cannot understand gesture and be concerned about people. Thus, he remains at the back step in his life. The child cannot understand what the teacher is lecturing in the class. It negatively affects his educational development. So, hearing impaired is a major cause of a child's development path. Now let's see definition of hearing impairment. Hearing impairment refers to hearing loss that prevents a person from totally receiving sounds through the ear. If the loss is mild, the person with this degree of hearing faint or distant speech. A person with this degree of hearing impairment may use a hearing aid to amplify sounds. If the hearing loss is severe, the person may not be able to distinguish any sounds. We generally use various terms for hearing loss such as hard of hearing, deafness, hearing impairment or minimal hearing loss. Deafness means a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing, with or without amplification, and that adversely affects a child's educational performance. According to the Rights of Person with Disabilities Act 2016, hearing impairment, deaf means persons having 70 decibel hearing loss in speech frequencies in both ears. And hard of hearing means a person having 60 decibel to 70 decibel hearing loss in such frequencies in both ears. In other words, we can say that hearing impaired means the individual who cannot hear the sound of another person. Hearing aids are essential pieces of equipment as they help hearing impaired children by amplifying sound. Now we look at causes of hearing impaired. A child may have some causes of hearing impairment which come as under. Number 1, congenital hearing loss. The ear and the hearing mechanism in the human being are made up of a number of tiny, specialized parts and millions of nerve cells. Malformation, damage, or reduction of any of these factors causes hearing impairment. Some types of hearing loss are present from birth. Several factors may be responsible for this. The most common congenital factor is genetic. A child with one or both parents with hearing impairment can inherit the dominant gene for hearing loss. It is possible to inherit hearing loss even if a grandparent is deaf. Diseases like jaundice, rubella, pox in the parental, prenatal, and postnatal periods can affect hearing. Number 2, acquired hearing loss. Hearing loss may be acquired after birth at any age. These may be reversible or permanent. Some factors that produce hearing loss are head injury, trauma can have an effect on the hearing mechanism of the child. Sometimes water sports can, due to pressure differences, rupture parts in the ear, lead to hearing loss. Continuous exposure to noisy environments like factories or blast sites can affect hearing. At first, the high frequency hearing is affected. Number 3, conductive hearing loss. External or middle ear problems, which are often mechanical in nature, cause hearing loss. This can usually be cured by medication or surgery. Middle ear infection are a common cause and cured. Next one is sensory neural hearing loss. Problem in the inner ear involving the cochlea, in hair cells or nerve cells cause sensory neural hearing loss. This type of hearing loss is irreversible. This can be congenital or acquired. Now we look at some characteristic of students with hearing impairment. Students turns head to position the ear to the speaker. Student asks for information to be repeated frequently. Child uses loud voice. Child does not respond when someone is speaking to them, and child has a restricted vocabulary and or problems with spelling. Student withdraws from classroom activities that involve listening. Less socially mature. Difficulty in making friends. Use speech, lip reading, hearing aid and or amplification system to enhance our oral communication. Use sign language as their first language with English as their second language. Now question arises, what can you do when you are working with children with hearing impairments or hearing loss? So, make sure the child can see your lips and facial expression when you are talking. Never talk with your back turned to the student. Speak naturally and not too loudly if the child wears a hearing aid. Try not to move around too much when you are speaking. If you have to move about, be sure to try and face the child as much as possible. Do not overuse hand gesture. Children do not like to be treated differently. Always ensure that directions, assignments, instructions are understood before the child begins working. Make sure to include the interpreter as an individualized education plan member. Make sure you have the student's attention before speaking. A light touch on the shoulder, web, or other visual signal will help. Seating, which allows a clear view of the instructor, the interpreter, and the blackboard. Look directly at the student during a conversation, even when an interpreter is present, and speak in natural tones. And discuss lesson with the interpreter prior to teaching. Concluding with the education of children with hearing impairment in India is just a little over 100 years old. Over 500 schools for the hearing impaired children are established in the country. The government established some schools, whereas the NGOs run many others. So in this way, today we have seen concept of hearing impairment. Thanks for listening to me.